before I went back to school. I might have had a grade 7 education, if that, and I know it was very hard, and especially like when people ask and talk to you on the streets, or you go to your doctor's office and they are talking to you, you just don't understand. Like, it's very tough without education to speak to doctors. It really is.
And you go to the hospital, that's even worse, because there's a different doctor on call, not your own. And they have to ask the whole same questions over again. But you don't ask about what level of education you have in the hospital. But they should.
I think this is one of the reasons why a lot of people don't go to doctors, is because they're afraid of not knowing. And then it comes down to find out that they just don't want to be in the doctor's office because they're afraid that they don't want to feel inferior, that they don't understand.
Roxanne, Alan, and Darlene are real Nova Scotians. They have had trouble making use of the healthcare system that we have in Nova Scotia. How can we make it better? My name is Don Kite, and I'm a pharmacist in Dartmouth. The issue of health literacy is something I see every day as I talk to people about their medications and provide advice about their health. This video will help make the connection between literacy and health. It will help you to understand the issue of health literacy, identify literacy limitations in your patients, communicate better with patients who struggle to understand us.
I know a lot of friends struggling too. When they go to the doctors, they're coming to me saying, "You went to school now, so tell me what's wrong," you know?
What % of your patients can understand and act on the advice you give them? Can you tell? We have literacy statistics that may surprise you. They come from the International Adult Literacy Survey, which measures literacy based on an adult's ability to complete everyday tasks that involve reading, writing, and numeracy. Think of a representative group of 12 adult Nova Scotians, maybe 12 of your patients. 3 in 12 have few basic skills. 3 in 12 have limited skills. 4 in 12 have moderate skills. 2 in 12 have high skills. That means that half of Nova Scotians are not able to cope with most medical information. They may not be able to read the instructions on their medicine bottle. They may not be able to understand a pamphlet on managing their diabetes. They may not be able to figure out Canada's food guide when trying to manage their weight. Level 3 is considered the minimum literacy level needed to be able to cope with the demands placed on Canadians. In Atlantic Canada, at least half of our adults fall below that level. That means they really struggle to understand us and to act on our advice.
Everything comes back down to reading. You have to know how to read somehow. You really do. That's what forced me to come back to school, because I realized I'm sick of not being able to read, because everything you have to read.
The Nova Scotia Departments of Health and Education are working together on the complex issue of health literacy. The first step is always defining the problem. We look to a national health literacy researcher for the Canadian perspective.
There's many different definitions of health literacy, but most of them seem to agree that health literacy has something to do with people's ability to access, understand, and process health information. It has to do with the way in which health professionals communicate with people. It has to do with the kinds of information that they're exposed to in the grocery store or over the media. Literacy is a very important determinant of health. Literacy will affect the extent to which you're able to get a good job, the extent to which you're able to work in safe circumstances, the extent to which you're able to earn a decent income. And that in turn will have a major impact on whether or not you experience health problems during your lifetime. And I think it's really important that healthcare professionals, administrators, and others give patients the tools that they need in order to be active participants in their own health care and to make sound health care decisions for themselves. My hope is that we will continue to develop research in this area in order to better understand what health literacy is all about and to help people achieve their health goals through access to and use of health information.
The research that is being done here in Nova Scotia is helping us see how health and literacy are interconnected. Evelyn Lindsay will tell us how one health board came to make that connection.
The Antigonish-Tanacana Community Health Board, in setting up our health plan, went out to our community to do our consultations, hear people's stories about what affected the health of their community and their own personal health. We then analyzed this information, and in analyzing it, we did that in the context of the determinants of health. The issue of education was brought up as a health issue. In particular, that issue was discussed as it related to the knowledge and the skills of everyday living. So this led us then to want to explore further the relationship between health and literacy. And this is where we became involved with St. FX University. This was done with the Department of Nutrition, the Department of Adult Education, and the Department of Nursing involved.
The Health Literacy in Rural Nova Scotia Research Project brought together people from Antigonish, Guysborough, and Richmond counties. A research team from St. Francis Xavier University held in-depth interviews with people enrolled in adult learning programs and those with limited literacy who are not in learning programs. They also held focus groups and interviews with community leaders. The results of this research are published in the report Taking Off the Blindfold. Dr. Alan Quigley, one of the co-investigators on the project, will talk more about its findings.
We learned a lot. Most people who would come into the health system, they feel perhaps a little intimidated or a bit nervous. A good number of them talked about coming into the health provider's world and felt, one said, paralyzed. They talked about being unable to pose a question, not being able to answer the right follow-up questions, not understanding the answers they were given. People talked about leaving more confused than when they arrived. People left with literature they couldn't read. We were able to determine how they saw the world. Like, how does the world look through the eyes of somebody who does not live in a print-based world like you and I do? What does this look like? And what does it mean? It raised what I think are important questions, strategies, possibilities for the health system and the literacy system of our province and beyond as well.
I didn't know what kind of surgery they were going to do. I was very petrified to not know who was doing my surgery. I didn't know what was going on. And I would have needed a step-by-step to understand what I was going to have done to me. It's my body, so I just felt very, very upset about that.
If we are aware of the problem, if we ask the right questions, maybe we can learn our way out of this, but we will do it with the help of others. It will be through partnerships. And so the research and the activity's only begun, you might put it that way. But we did point to some possibilities that might lead to some changes. Awareness is clearly one.
Alan, Darlene, and Roxanne are adult learners who are willing to share with us their experience with the healthcare system before they upgraded their literacy skills.
They don't know my education level, so it's like, it's hard to, okay, you're asking me how old am I, so I can take this medication, but I'm not understanding why I have to take this medication.
I have gone to my doctor and I forgot to ask him a more important thing that I was there for.
We have to be more responsible with ourselves and let them know that we do have a problem, and just try not to feel intimidated and say, listen, like, I have a problem here and I don't understand it and I need to know. Could you break it down for me? And that's with your doctor, your pharmacist, or whoever you're dealing with. That has to deal with it's your body, and you need to take control of it and let them know, like, I have a weakness here and I need you to help me understand it.
People don't come into the office saying that they have literacy problems. People come in with health problems. And it's often in trying to explain their health problems or their concerns that you become aware that there are other issues. And one of the commonest things usually is frustration. People come in and they have difficulty explaining what the problem is. And when you suggest some form of treatment, they have difficulty understanding what the treatment is. And when that happens, they get frustrated. I think most practitioners will have been aware of people who will bring in the form and you say, yes, I'll fill out my section, and they ask you to fill out their section as well. That's often where you become aware that people have literacy problems. I think it's important for us to be aware, to be mindful that older people will have particular problems with literacy, with understanding what goes on in the office, and with remembering what we suggest they do to improve their health or deal with a particular health issue. That they tend to bring in someone with them. Usually it's older people, they bring in their daughter or their son, which I think is a very good thing, because a lot of people, when they leave the doctor's office, they forget almost immediately what went on in the room. So people with literacy issues don't tend to ask as many questions. Because we always are pushed for time, we can tend to rush people in and out, because if they don't ask questions, we think they have no more concerns. You also find in rural areas, people tend to stay in rural areas, and you don't tend to need, or you didn't in the past need, as many literacy skills to function, especially if you were working fishing in the woods. We tend to, automatically think that when people left school, they had a certain literacy level, and that has stayed with them throughout their life. But I don't think that's the case. It changes, and in many cases, if you don't use those skills, it deteriorates. So just being aware of the fact that people have literacy issues is very, very important.
I know they don't have all day, but I don't understand what you're saying to me. Slow it down and understand.
They're going to start reading our body language. Right? If you've got someone in your office and they're trying to explain to you what their illness is and they're struggling, then there's more wrong than just their health problem. They've got a problem with their literacy, and they should stop right there and to say, well, I got to back this up, and deal with it on that level.
If our communication is overlooked, then the message for the entire visit may be lost, and then we haven't done our job.
Nurse practitioner Kimberly LaMarche has a particular focus on communicating clearly with her patients. She will share with us some techniques that can help you connect with your patients.
Healthcare providers can do any number of things to help their patients understand the message they're trying to get across. I think one of the most important things they can do is ask the patient how best they learn. Is it a pamphlet? Is it an internet site? Is it another healthcare provider? Is it a workshop? What is the best way that they learn?
Because some people are visuals. They need to hear it. You got to have it in front of you in order to take it in. You can hand people out pamphlets, but I'll tell you, 3 out of 5 people will probably not read them because they're either afraid of what's in it because they can't understand it. So if they have workshops where you can go to on certain different things that you might be affected by, then they'll get it on a verbal situation, on a verbal level, which would be helpful.
Another thing that healthcare providers can do to help their patients learn is to understand their literacy level or their education level. So perhaps asking the question, where did you get in school, or how would you consider your understanding of the newspaper, that sort of thing, to see where they are. Because if you just hand them a pamphlet and maybe it's a grade 10 level and they're reading at a grade 3 level, that's not appropriate. Ask
what grade level you have. An educational level before they ask any of the medical questions. Just because unless you don't understand their language, what kind of words they're using, they can explain a little better in detail and simplify it more.
Healthcare providers should take in consideration the fact that language may be a barrier within their communication with their clients. You need to make sure that they fully understand the information that you're presenting to them. So there are various ways around that. You can include diagrams, because diagrams are cross all language barriers. You can go to community organizations, ethnic organizations, and see in your community if there are people who can assist your patients in understanding the language as you present it to them. Putting language in terms the patients can actually understand. And if you do use words that are medical in nature, ask the patient, what does that mean to you? To help to make sure that both the patient and the provider are on the same level.
And they're talking to me with the grade 12 or university education, or using all these different medical terms, how are we communicating?
If we do provide health information in print form, I think it's imperative that we explain to our patient what is on it. Read it together and say, so what does that mean to you? Do you understand that material? Is there anything we can do to help clarify it?
Well, I'm really scared to say, excuse me, can you explain to me what I'm taking? Because I can't read that. If you can't read, I'm taking this home and I'm putting it in the garbage. It means nothing to me.
Another approach that we can take is to use our collaborative team, whether that be physicians, pharmacists, nurses, educators, whatever the appropriate professional. So, for example, if I'm prescribing a medicine to a person that I think might have some issues with understanding or remembering, when the prescription goes in, we can just ask the pharmacist to call the person at home. The patient then has two confirmation sources of how to take the medicine. And it also provides the patient a second opportunity to ask questions if needed.
They should actually know where your level of education is at, so they can either write it out for you and give it to you and say, this is, go to the pharmacist and ask for this. That way they know that you can't look for it for yourself.
Healthcare providers are often crunched for time. I don't think we can overemphasize the need to take the time with our patients.
This morning?
We need to make absolute sure that the information we transfer to them is understood and clearly taken home as the message that we intend it to be.
I just think doctors need to understand us and we need to understand them, but they need to ask more questions or check our backgrounds and just see, like, did this person go to school? Did you go to school? Just ask small questions.
If our communication is overlooked, then the message for the entire visit may be lost, and then we haven't done our job.
Health literacy is a complex issue. Raising awareness is a first step. We hope we have given you something to think about as you talk to your patients and have helped you make the connection between literacy and health.
But we will do it with the help of others. It'll be through partnerships.
We need to communicate both ways. They need to understand us and we need to understand them. So there needs to become a way where we can just understand each other. Literacy teaches you so much about how to be healthy.